hot here where I'm at. I don't know about where everybody else is at, but this is July 14th. Welcome everybody to Redox 5. My name is Dr. Lee Ostler. I am a dentist in Washington State. That's in the United States for those of you outside. And we have Dr. Ray Dixon joining me tonight as a co-host, taking the place of Dr. Maureen Hayes and Jim and Ann Glenn, who are off in the sunny islands of the Caribbean, enjoying some kind of a break that they think they deserve. And so we will join up with them next week. We have with us tonight Dr. Ed de la Reyes. Dr. Reyes, thank you for being with us tonight. We've had you on once before, at least that I've been on with you. And you've got quite a story, and I'm anxious to hear it again. I've got some questions also lined up to ask you because with your medical background, you become one of the experts, you know, to officially guide us in this unique health thing. We will start off by making a disclaimer. We are representative of ASEA Global, which is a company founded in Utah, the state of Utah. That's where they're headquartered, and we make a supplement, a health supplement that is a cellular health supplement. So by definition, we are a cellular health company, and we market this through a process called networking, which is what has brought us all together here this evening and through the last few years. But as a supplement, we do not make any claims for treating, diagnosing, or curing. We'll make that clear here at the outcome. We will be talking about health matters. We'll also be talking about perhaps some financial matters as to why 3 doctors would be involved in this. What's interesting tonight is we have a physician, a dentist, and a chiropractor, naturopathic physician. So you're going to get a cross section tonight as you hear us talk that comes really, there's a wide breadth of knowledge and background, and all of us, each of us, have done an immense amount of research. And so we are not, we haven't just fallen off the turnip truck, as they say. We've got some skin in the game here. So Dr. Reyes, we're going to call you Dr. Ed tonight. Dr. Ray, Dr. Lee, Dr. Ed, would you come on and explain, maybe for our audience, so there's going to be many people who are listening for the first time tonight. Describe who you are. You know, what is your background and your qualifications, and why are you sitting at the table? And then maybe you could segue that into how ASEA has touched your life and how you got involved and why that even brings us together. So thank you again for being with us.
Thank you, Dr. Lee. Again, I'm glad I've joined you again. This is almost 6 months since I was in this forum, and truly enjoyed the company. But of course, we miss a lot of people. They're enjoying while we are working, and I think they deserve it. Welcome, Dr. Ray, and in here. I was not expecting that you're the one that's coming, but and so we have 2 scientists in here with us. And so for me, I am originally from the Philippines. I migrated here in the US in 1983. So I went to med school there, and we use American books. And as a student, it's always our dream to be able to be trained in a country where all these books came from. So that was a dream, and I came in '83, and by the grace of God, I was able to be licensed in that same year, and then also had the privilege of being trained in 2 specialties. So I trained first as a pediatrics in pediatrics, and I was preparing for my neonatology fellowship, which is a subspecialty after you finish pediatrics, when a colleague of mine convinced me to go into anesthesia. So instead of taking the fellowship for neonatology, I went into another residency training, and then I finished anesthesia, of course, and then did the subspecialty in interventional pain management. So that was the scope of my practice then. And so I became an interventionalist, and most of my practice in the 80s, that's when I started, were done in Washington, DC. And then in 2005, I moved to Kentucky. I was brought in to help out a pain clinic. So at that time, they were doing 6 procedures a day. So we built it up to 40 procedures a day, and then also from 1 clinic to 4 clinics. So, but that was kind of the start of why I got involved with ASEA. I think my story started in 2015. So after I worked so hard, I enjoyed what I do. And this type of work, we wear a 20-pound lead jacket. And so when doing 40 procedures in a day would just have you put it on and not being able to take it off until the end of the day, which is almost about 6 o'clock, 5 o'clock. And so it's more than almost a 12-hour day. And so, and it's just 20 pounds. And before I knew it, one of the times that I came home from a long flight, all of a sudden I developed a severe discomfort from my back. And so this discomfort went down to my right leg, and it's within my specialty. So I had taken some pictures right away, went and have that thing examined in my back. And when I went out, a radiologist called me right away when he read my imaging, and so told me that I need to see a neurosurgeon as soon as possible. So I have a very good friend who's a neurosurgeon. I called him, I described to him what the description of my picture is. And of course, the radiologist told me that the tips of the main nerve inside the spinal column is really not doing good. It cannot have some blood flow to those nerves, and I need to have it fixed. Of course, my friend told me that, yes, you need to have it fixed. And then, but my bias was, I was an interventionalist, and 90% of my patients are patients that have this type of procedure. And so I don't want to become like my patients. So I consulted five more neurosurgeons and spine surgeons to get the second opinion, and all of them agreed. And all of them says you have to have it done as soon as possible. So I did my research. I went to one of the best centers. They're composed of 65 neurosurgeons and spine surgeons, and then very good. And I chose the one because I have an insider. I have my nephew who works with them as an anesthesiologist, and he's the one that knows which of those is the best one. So I went to the best. And then I have some inside tips, and he said, hey, his success rate is 90%. He's not just a chairman, but he is the most busiest one. So I did, and I was kind of confident that I'm going to get well. And fortunately, after the procedure, I belong to the 10% failure rate. So in short, I became a patient of my own specialty. From anticipating that this is going to be well, it failed, and I became a chronic patient of my own specialty, which is pain management. So I was placed on 5 modalities, and then blocking all receptors that I should, and that way I should not feel it. And but I still could not be comfortable. At night, I could hardly sleep. Every hour, this discomfort wakes me up. So I have these 3 controlled substances that really distracts my brain, medications that is short acting and long acting, but I still could not be comfortable. So every follow-up that I do with my surgeon always tells me that we have to redo this. There were already rods placed in there. There's already metal plates and screws, and that they just want to redo it. They involve scraping and taking some bone parts from 4 levels, and then of course those metals. And I just could not do it. Most of my patients that have more than two procedures done in their back end up in a wheelchair. So I don't want to be like that. So and then every time he tells me that, hey, we need to have it done. I said no, I could just do this. And he told me you could no longer work with the condition that you have. And I said, just sign me off, and I can make adjustments. So I did make adjustments. I did not really stop working, and then I dropped my pain practice, and I just supervise nurse anesthetists and then run the schedule, and that's what I basically did. But from walking on myself, I have to use assistive devices to help me walk, and I was on this medication. And every night I'm just fatigued, and every day to day basis I was fatigued. So when it comes to my annual follow-up, this is over a year already. I came in at that time, I was just depleted. I was already discouraged. I was frustrated. And then when he told me about doing another procedure, I said, let's do it. If you give me a knife by then, I would do it myself. I would yank this monster out of my back, and that's just how I feel. So the lucky thing that happened to me is that it took 2.5 months before I could find a space. He's a busy surgeon, has a lot of commitments and everything. So that was a good thing that happened to me, because there was at this time that I was introduced to ASEA. And the one that introduced to me was my brother-in-law. And I was not really asking a lot of questions about it. Right? And because he's my brother-in-law, out of respect, I'm just going to use it, and I'm would be done. But deep in my mind, I would just have this thought that absolutely this is not going to work. Let's just get it done. Let's drink it. And I said, well, you have to commit for 3 months. I said, okay, I could do that. And then and that was my whole thing. I know they're not gonna give me poison or anything, but I said, okay, let's just try it. And with no expectations at all, I did. And then to my surprise, though, in just 5 days of taking it, in the first week of taking it, I was taking it just 2 ounces twice a day, and also rubbing the gel in my back. And I felt the best sleep I ever had in over a year that since I had surgery. And then that surprised me. I said, okay, this is like a coincidence really, but day after day after day just got better and better and better. So
Dr. Ed, what was the dosage at that time that you started on? How much were you using?
I was just using a cup twice a day.
Okay.
And I was rubbing the gel in my back, and that's just a simple thing. But for me, it was a 10 down to a 6 level of discomfort. And that was a big thing for me. And that made me sleep, have this really rapid eye movement sleep that I just happy thoughts and have things. And when I got up, I would feel so rested that I just could not believe that thing. And the good thing is within those weeks and days that coming, I got improvements and improvements. My thinking was clearer. My depression really got improved, and I was just relieved in all these things. Because
there was a time interval there. You said the first 5 days you had a really wonderful sleep, and then these other issues of clear thinking and so forth. What was the time parameter? Was that like days, or are we talking weeks, months?
Oh, just weeks, and then gradually the pain levels, the discomfort levels came down and came down and came down, and
it wasn't like all of a sudden. It was a gradual.
Yes, it was a gradual thing, and within that 2.5 months period of time, that I was able to wean off myself from these 5 modalities.
Oh, wow.
Wean off myself from this control substances that was not really doing anything. It's just confusing me and altering my senses and everything. But I was happy at that. And when this was when I had my relief, and within that 2.5 period of time also, I was able to get off of this assistive device. Just from the 10 to a 6, I kind of, and I just admitted that the 6 is really where I'm going to be. And then, but I'm happy with that. I'm able to walk with the things. But after 300 yards, I have to stop. I have to sit down and then stop and then walk again. And so that's how my life, but hey, I got no assistive device. I'm just happy about it. So that was my thing. And it went through these things, and I was a preferred customer, and I really didn't care about joining. I was just using the product, and I'm just thankful that that this happened. But deep in my thought is that I was still skeptical. I did not still fully believe in this. I said at that time, I was 100% sure that it's not going to work. This time that I have relief, I said, if this is 100%, that it was a placebo effect. And so I just didn't, this is really nothing. I'm just happy that, and I just continued though. Then I thought about my mom. My mom was 90 years old at that time. And then she had a condition in the brain that really had caused some weakness in the right side of her, and also really took out her speech. She was also very depressed. So she's just had an expressive component of this one, and could not talk. So my intention with her, because it gave me good sleep and it gave me good energy during the daytime. And so I just want my mom to experience this results that I have. So I recommended it, and I asked my brothers and sisters. So finally they approved it, and we tried her on that one. So those are the two things. And I was still skeptic. I said, this is that. I just want my mom to have this thing, so if it really works. And to my surprise, in 2 weeks of using it, still same thing, 2 ounces in the morning, 2 ounces at nighttime, and then rubbing some renew in the neck and wherever there is pain and wherever there is skin lesions. And to my surprise, this is really the thing that brought me and really turned me around, is when all of a sudden she's talking again. Her speech came back. She's communicating again. Her smiles came back. And that surprised me, this placebo effect. And then when this thing happened to my mom, I could not explain it in my own specialty. I said, I need to read about this. My first exposure about redox signaling molecules was when I was in pediatrics. This drug that came out that really won a Nobel Prize in the 1990s, which is nitric oxide, came out in our articles way in the 80s when I was still doing pediatrics. And this is a good drug. It helps with pulmonary hypertension without touching the systemic pressures. That was a good one, but I still was able to use that when I became an anesthesiologist in the cardiac cases that we have. But that is just the thing that I have an exposure to redox signaling molecules.
So it sounds like, you know, you had your own personal experience, and you were somewhat willing, notwithstanding your profound awareness of your own improvement, you were somewhat willing to write that off as kind of placebo, which obviously it's a part of pain management practice. I get that. But then when you saw your mother have an experience, that'd be like having a dog or a cat or an animal, you know, get better from theirs, and then saying, well, they were just thinking that, you know, themselves better. You actually saw it in somebody else, and that really kind of changed things around. So that's an incredible background. That's an important part, and I point that out because, you know, this idea or the charge that, well, that's just a placebo, we hear that often. And that might segue us in here, and maybe we can have you comment, and then I'd like to have Dr. Ray comment. So somebody who's watching this for the first time, they hear this story about your back procedure, your back pain, your reliance on, medical intervention, both pharmaceutically as well as surgically. I'm sure you had a bunch of physical therapy wrapped into all that, through the time as well. So you had three at least types of modalities in addition to different types of medications. That was your experience. But let's maybe segue here and describe in plain English, if we can, what this is that we're talking about. When we talk about redox signaling, could you take a minute and pretend like someone that that doesn't know much about this, and they come to you and say, Dr. Ed, what is this? What would you say to them?
Well, I like your concept, really, reading your book about the inner doctor in us. And when the good Lord has created us, he has created also an inner doctor with us that really takes care and monitors all the functionality of each and every cell, trillions of cells. And this inner doctor that's all over running around is the one that sees it. And if there's something abnormal, he fixes it. And then if it cannot be fixed, he replenishes it. And then so all the cells, the tissues, and the organs, and within those systems, it can function well. So that's what it is. But what happens, though, is this inner doctor can be lost. Naturally, it can be lost after puberty. But 1% of this one are lost. And with time, you lose a lot of things. But also with abuses that we do in our body, when we subject ourselves to stresses, and not just psychological stresses, which is really the common stresses that we have, but stresses like infection, pathogenic, the way we treat ourselves, what kind of food we eat, what kind of environment we are in, and then also how we treat and maintain our bodies by exercising. And all this is a factor to put this inner doctor in us to be disabled and not function well. So now we have a way to bring back this inner doctor within us, activate the whole system, make it really into a redox homeostatic environment, that everything is balanced, and foundationally all the cells can work much better.
That's great. Dr. Ray, would you chime in there? A fundamental explanation of what is redox signaling, why it works. We're designed this way. So how does this work in your mind?
Well, Dr. Ed, I must say that's a fantastic story. I'm actually thrilled about your results. As a chiropractor, I'm also a naturopath, but as a chiropractor, you'd appreciate I've worked with a lot of those disc protrusions and osteophytes causing those terrible sciaticas. And so I well know what probably you experience to some extent. If I may, Dr. Lee, before I answer the redox modus operandi as we understand it, it always fascinates me with placebo. I mean, the implication of placebo is that it's all in your mind. And because you've changed your mind, you're better. It's always fascinated me in the natural medicine field, because obviously they've been accused constantly of placebo, and it's not the herb, and it's not the vitamin, and it's not the supplement that just gives you expensive urine, etc., etc., etc. It's placebo, saying it's in your mind. And so therefore, when your mind shifted, the problem went. And I don't doubt there's a great mental stress or factor that can be relieved. But obviously, when you're experiencing the kind of pain down the leg that Dr. Ed did, there was a lot more to it than placebo. But, you know, we are all critical thinkers, and we're all brainwashed to think in particular ways. So I well understand the skepticism. It took me 2 years before I took a serious look after being told about it. And that's skepticism as well. So what is redox? Well, the inner doctor is the only doctor. So the reality is we're all called doctors. We operate within the territory of the inner doctor. So the body has its own self-healing mechanisms, and they're multi-layered. you know, you've got first line of defense, second line of defense, third line of defense, right down into the adaptive immune system at T and B lymphocyte level. So the whole healing processes are inbuilt. They're inbuilt, they're in-programmed. And there's a multitude, and they are regulated by signaling molecules. Now, not just redox signaling molecules. There are many cytokines and leukotrienes and prostaglandins and hormones and neurotransmitters that are involved in this whole regulation and self-healing process. Where I feel this is a revolution is along the journey of us practitioners helping to work with the inner doctor with medications and nutrients and phytochemicals. We've now found something at the deepest nano-size level that trumps them all. It essentially, they're made in the mitochondria of every cell. They're made in the trillions per second, per minute, per hour, per day. As Dr. Ed said, they're declining from puberty. And they regulate everything else. So it's like they're at that interface of energy and matter, as you said in your book, Dr. Lee. So they're at the pinnacle of everything else. So my view is once these were discovered, the irony is they're made from salt water. And of course, that might sound trite, but the reality is we're full of salt water. And they are made from sodium chloride, hydrogen, oxygen, some, as Dr. Ed said, with nitrogen, like nitric oxide, which is plentiful from protein sources in most diets. So the interesting thing is that as the redoxome, the redox signaling molecules control the genome, then the genes and the DNA regulate pretty much everything else. We've kind of stumbled on, science has in its journey, something unique that affects healthy functioning of all cells. Now, all diseases are sick cells. So it doesn't matter if it's hepatocytes of the liver or, you know, neurons, neuroglia of the brain, they're all cells. And we now know that it's essentially deficiency and imbalance in these redox signaling molecules, which is resulting in malfunctioning sick cells. You know, nature, that inner doctor doesn't care the name of that disease. We do. We all get enthralled with diseases in the health practitioner industry. But once you have something that you supplement and correct that imbalance and deficiency, then those cells just start functioning better and working better. And that, in my view, is why there were such profound results across completely different conditions with Dr. Ed and his mother. I mean, these are completely, entirely different parts of the human body. The lower spinal cord from the brain is a very different entity, you know, blood clots or hemorrhage causing, you know, brain issues and strokes, etc. It's a very different entity to, you know, disc protrusions and compressions of the lower spine. And yet the results were unique in both, even considering the age of his mother. Isn't that remarkable? So I hope that gives a little insight into the way I see redox signaling molecules working.
Thank you. Dr. Ed, I want to ask you a question here. As a physician, in fact, I had this come to me today by another doctor who I did a call with earlier, who quizzed me on the salt content. You know, and because on the bottle, on the side of the blue bottle that this comes packaged in, it says saline. And of course, people who are on sodium restricted diets, have kidney disease disorders, heart, you know, cardiovascular issues. That's a consideration that they have just in their normal, you know, diet and maintenance and so forth, is milligrams of sodium that they intake every day. Could you just quickly comment on that? And how do you respond to that? What's your strategy for dealing with the salt, the supposed salt content issue?
Yes, the thing is, I'll give them the quantity that we have in a 4-ounce volume. You only have 120, 125 milligrams. which is equivalent really to 3 pieces of carrots or a slice of bread, and that would be it. For salt-restricted patients, really absolutely, not absolute, but salt-restricted, we die if we don't take any salt because our bodies are made up of saline solution. You need some salt. So a gram, normally we take about 5 grams, 5,000 milligrams of salt, and then for salt restricted, you can even go down to 1,000 milligrams. So 125 in a day's dose, it's nothing. And so unless they're restricted not to eat sliced bread, or they're restricted not to eat those 3 pieces of carrots, then that would be a problem. The problem most of the time when they look at this bottle and they say, oh, this is salt, purely salt and water. And why are you saying it's only 125 milligrams in it? Oh yeah, that's the source on where this redox signaling molecules are made. But it's not that all this salt is left in there. It's converted. The mixture of different molecules interacting with each other is no longer salt, but it came from salt and water. And but that's why it's just that small amount in there that is left. These are just residual, really. That's they travel. I think in the bottle they're still busy, they're still moving, and so.
Thank you. Also, I want to come back with you because I think this relates to your malady, that you experience, and that has to do with inflammation or the consequences of inflammation. One of the things I've noted over and over, and it's true with me, I kind of have the same issue that you spoke of and which Dr. Ray treats all the time, only not in the lower back. Mine's in the upper back and the neck area, just because of my professional posture. I would call it professional posturing. It's been significant for me. And at one time, this was actually during the shutdown of the 2020 era, I went and had it looked at and was told, well, if we do this, you won't go back to work. You'll have like 7. They didn't count it up exactly. It was just a consult, but like 7 to 11 levels will be fused, and you're not going back to work. And I thought, well, that doesn't work. I'm not ready for that yet, right? And yet I'm having profound discomfort, and numbness, and tingling, and so anyway, I did what our other esteemed co-host does, Jim Glenn, when he talks about his issue, where he doubled his dosage, right? So I thought, well, what have I got to lose? And this is after 18 months of being on 2 ounces twice a day. So even at that level, it wasn't that impactful for me. But when I doubled that within 5 days, 6 days, 99, probably 0.5% of all of my back discomfort, my tingling, numbness in my arm, going to sleep while I'm sleeping, my extremities is gone. So I want to tie that in with you because I think, we can sing off the same page here. And Dr. Ray and you kind of professionally can look down your nose at us and say, see, I told you so. But but I think in my own case, I don't necessarily believe, and I don't have data like a radiology study to prove it. I don't think the stenosis went away, but I do believe that the inflammation did. And so could you address the idea of what redox signaling does to the inflammatory pathways? Because I think that's a basis of many, many diseases.
Yes, exactly. And thank you for bringing that. And that ties down to the studies that we have with Torrey Laboratory, that it would increase the gene pathway, turning it on by 31% on the inflammatory functions. Now, in the practice that I have, I always, the only armament that we have is steroids. So we use this, we inject it wherever, because our school of thought that wherever there is pain, there is inflammation. So the way to eliminate pain is eliminate the pain and inflammation, eliminate the inflammation, and the pain will be gone. And so we inject it where it's needed. If it is a disc problem, if it's a problem of the joints, if we inject it right there. The problem of any other tissues, we just inject it there. And then and of course, I had my procedure done before being exposed to ASEA. And then when I encountered another patient, and this is in the Philippines, that has almost an identical picture as mine and same type of management, he needs to have this surgery. And then I thought about it. If I had found ASEA, maybe this is what I'm going to do. And also, it went into that same patient because he was not willing to have a procedure done on him. He said, whatever ways that I could do. So I said, well, okay. I thought my instincts in my own practice is that, okay, let's just do an epidural steroid injections in this one, give the steroids, and then let inflammation come down, swelling goes down, relieves the compression, and I think you're going to be having some relief. But what we did, because I was in a different island where I really, when I called about my own specialty there was hardly anybody that's doing this stuff. And so I said, you know what, let's do these things. Let's give you ASEA every 2 hours. And we'll do that every 2 hours and every 2 hours until you're going to have relief. And we did that one, and we achieved what steroids was achieving in injecting. And so I was happy that there's actually things that we could do with this type of patients just like mine. And I don't have to be on the knife to be able to do these things.
So you were observing this in other patients that were similar to you. Is that what you're saying?
Yes, that's what I'm saying. And then so he got pain relief. His movements are much better. And so if that's the kind of thing, then it can buy time. The inflammation, as long as you don't aggravate inflammations anymore. So that releases the compressed nerves that causes the pain, and the compressed blood vessels now is freed up, and then blood supply is reestablished. And then because of what? Because we just applied the principle on how this redox signaling molecules is going to turn on the gene pathway for inflammation and improve that thing and acts on it. So it is an amazing thing to do that we could do. And if you give it every 2 hours, it's just like an acute thing that we're doing. You are having a steady state of these molecules in the body. So you give it, my understanding with this is that the half-life is about 2 hours. So you give it every 2 hours, every 2 hours, every 2 hours, you have a steady state wherein this molecules is present in your body, taking care of all inflammatory conditions.
So I want to emphasize to those who are listening and who will watch this later that what we're describing is not a treatment or a cure. You know, the redox molecules, as one of the themes of our evening tonight is about awakening the inner doctor, which is it's a descriptive way of describing how you activate the cell's defensive pathways that produces healing or response or renewal or regeneration from the inside out, if you will. It's not an intervention. So I want to be really clear on that, that we're talking about the relief of discomfort because we're reducing inflammation. That's a mechanistic process. And so therefore we're not talking about a treatment. Dr. Ray, would you chip in maybe and take a minute and talk about this pathway thing? Because what Dr. Ed was talking about in the real world of medical intervention, or even in our over-the-counter use today of things like aspirin or whatever, you know, we're talking about anti-inflammation because it's a drug like looking for a receptor site to block, you know, a pain pathway. But that's not what we're talking about here. When we talk about it's reducing inflammation, it's not an anti-inflammatory that comes in after the fact that knocks it down. It's further upstream. Could you take a second and describe what we mean by pathway gene, and that we're like dealing with inflammation before it's inflammation?
Yes, indeed. It's interesting also when Dr. Ed was sharing the 4 or 5 medications that he needed that affected the brain because they block receptor sites. So, of course, they're blocking receptor sites, but the spin-off effect of that is not only the dulling of pain, but the dulling of many other functions as well, including other brain functions. So no doubt as the healing process occurred and he was able to come off those medications, that dulling effect at the mental level would have completely recovered and been removed. This comes down to that whole evolution, actually. I'm old enough, I think I'm one of the oldest in the group here. I'm old enough to remember when the whole terminology for painkillers shifted. And it shifted to anti-inflammatories. And we could have an interesting conversation on what's the difference between a painkiller and an anti-inflammatory. Well, of course, you know, we can have the dulling of receptor sites for pain. And there's a very fine line here. We're kind of looking at this from the back end. You know, when you have, if I can just begin by saying, and agree 100% with what you've both said about inflammation, just for the benefit of the listeners, if you've got disc protrusions or you've got spurs hitting nerves, you get an inflammatory response. That inflammatory response increases swelling. That swelling is what brings about greater levels of compression and therefore the symptoms that ensue from that, whether that's pain, whether that is numbness or tingling and those other paresthesia type reactions. So what's being discussed here is really interesting. It's like saying, you mentioned, Dr. Lee, the word stenosis. Now, for the benefit of the listeners, that's where calcification narrows and compresses nerves. Now, Dr. Lee said he doubts the stenosis is gone because that is probably not going to happen. And I agree with that. So what did happen? Why did that discomfort remove? And he was able to forego surgery and be better than he was previously. Well, that is, as we've all agreed, because the inflammation subsided, even though that calcification and stenosis is there. The difference is which end you're coming in from. The medical model, the pharmacological model, is to come in from blocking receptor sites, use corticosteroid is cortisone for the benefit of the listeners. Cortisone is a well-known anti-inflammatory, but it is immunosuppressive. It can also demineralize bone, by the way. So, you know, as with all drugs, there are consequences to drugs, not always favorable, but it is a powerful anti-inflammatory, which is why when people have those injections, they get such good results. Once again, verifying that when inflammation is reduced, people feel better. Now, the fascinating thing, and the question you've asked with your poignant brain there, Dr. Lee, is how do we come in through the back door? Well, this is what redox does. Because redox signaling molecules are at the coalface of regulating inflammatory response and immune response, when we give the body and replenish that deficiency, then that whole process of the inflammatory reaction to the problem is reduced. The problem is there, but the inflammatory reaction is reduced naturally, you might say, natively from inside the body, because things are calmed down, because they're getting a better quota of redox molecules. Now, if I can also say something that pertains to what Dr. Ed said, because, you know, we can get lost in our conversation and forget the audience in many respects. And it's important to note dosage. You know, most people begin on 2 cups a day, which you did, Dr. Lee, I did, Dr. Ed did. And this is not the be all and end all of correcting your deficiency, because there is no test for how deficient you are and how exactly many of these you need for your optimum effect. But certainly in my experience, 4 to 6 of these a day is where I encounter most of my extraordinary miracles. Now, that doesn't mean, as we've had on the call here with Dr. Ed, I mean, he had an astounding result in a short period of time on 2 cups a day. But it's really important for everyone to note 3 to 4 months is what we recommend to try this for. And if 2's not giving you the result, double it to 4. And if you're not seeing a result on 4, take it to 6. And as Dr. Ed said, stagger that through the day. Don't just necessarily take 6 cups in the morning. I would be doing 2, 2, 2 if it was 6, or 1 6 times through the day. So do be persistent and give your inner doctor time to get that job of healing done. Healing is a process, exactly the same as getting diseases is a process. Those processes take time. So, you know, if you can reverse in 3 to 4 months dramatically the damage from whatever label you wish to call your disease, just factor in it probably took you 20 or more years if you've got a chronic disease before that even came to where you now experience it. So if you're getting results in 2 to 3 months, you're doing great. If you're getting results in 5 days to a week or 2, you've just encountered a miracle.
Thank you. Hey, Dr. Ed, I'd like you to approach the elephant in the room right now. That it's like nobody wants to talk about this. I mentioned earlier when I gave the disclaimer that we don't diagnose, treat, or cure, that this was a cellular health company that we've become associated with. And we've got 3 individuals here on this panel. All of us have been through extensive, education in different medical arenas, healthcare arenas. As I said, we didn't just wake up one day and find ourselves here. We spent years, of study to get here, and then all of a sudden, something like this comes along that profoundly changes the course of our life. But I go back to your comments about, you said I was going to just honor my brother-in-law, and I was just going to do it kind of like to humor him, to get him to go away maybe. And then you couldn't deny, what happened, even though you tried. You had to test it out on your mom. So did you have a hard time accepting the way this company was marketing? And how did you approach that and resolve this issue? That what we're talking about of awakening the inner doctor through this type of modality was actually happening through networking.
Yeah, I think I have no problems at all with that. I think it is the best way that we could distribute this to people. And then we in the medical field under the pharma rule, that if a company would try to have this FDA approved through the pharma, then they only approve it for at least 1 to 2 indications, and that's the most. And this does a lot of things. It only works on one thing. It only works on cells, but almost every organ systems that we have are composed of cells. So it's going to work in that way. I think the company was so smart about, hey, let's get away from that, because it's always just like a non-formulary use of this, because you're using it for this and this and that. And then plus you have to have a doctor's visit so that you could access to this one. But one and foremost is that there is no toxicity in these things. So you could actually do it directly into the people. And then the environment of our community, the environment of how we do things, is that it works on only one thing, and you go by a supplement, and almost all the effects is considered a treatment, which is we are restricted from telling, from saying. How are you going to advertise this thing? If the whole thing is a treatment and you're going to put this in healthcare stores and everything, and you cannot advertise this is good for this, good for that. So it's only by word of mouth that you could have this pass on through. And you know what? They've been tested. They started since 2009, and we are restricted from saying this is a treatment for this and that and that. But every year it grows. It grows because why? It works. And it's only through this model that this can be really ideally be distributed. Not in the pharma thing, not in the other modalities of, well, let's advertise this. Let's put it on TV, and then let's have it in all health stores. It has a lot of information that needed to be communicated thoroughly, just like what the forum that we're doing. And then unless the whole system now changes, if nobody controls us for whatever this thing, then we could do and change it. But right now, this is the best model. And I know that, yeah, go ahead.
So what do you say then to people who say, well, I've tried it and it doesn't work?
Oh, it always works. The thing is that you have a lot of manifestation. This molecules as priorities, mine was just, it's just depleted in all these things. The inner doctor was not there. Every rules of my body in my systems, which is the musculoskeletal and peripheral nervous systems, is just out of whack. When this came into my body in that kind of condition, this was the one that grabbed it right away, because this is the component and the system in my body that needed it the most. That's why it was kind of focused, self-directed into that aspect. No, I don't think so. It's just that this system is the one that's really bothered and needed all this redox signaling molecules. That's why I had good, profound effects in just 5 days' time, and it worked in that way. Some people are kind of, I want this, but I don't have an effect. It's just these molecules are prioritizing others in your system that needed it most. And you might not see that because what your intentions was, I want it in the system, but you cannot see it. That's why I always encourage people to have the blood work done. It's good that they have a blood work before taking. And then if you don't feel a thing, just have another blood work, especially if your blood works before are abnormal. And you could see changes. You could see positive results. And it does work all the time.
Dr. Ray, how do you approach that? And also, could you weave in a comment about lifestyle? Like, what does a redox lifestyle look like?
Sure. Look, I think it's very, very important to understand when we're crossing the spectrum of the world of people out there and all their issues. We're not saying that every single case of any of the conditions we've discussed tonight, which happens to have a bit of a musculoskeletal theme, will 100% always be resolved by, giving the body what it needs to heal itself, which is essentially what redox does. I mean, there is the point of no return, by the way, with some conditions. When I say no return, I mean where you will need surgery. This does occur, and we've experienced that, and I've experienced that with people within the world of ASEA where they did need surgery. But also factor in the recovery of damaged cells from the surgery. Surgery itself may help to remove a compression or a problem, but you've still got incisions and the normal healing response of what needs to occur, which would always and most dramatically be accentuated if you were already supplementing with redox signaling molecules. So the first thing is always persist. It is working. You don't control where redox molecules go to work. Your inner doctor does. You don't know what other problems you might already be developing, where they may well be going to work. But of course, you will judge on results in the area you're looking. So you have in your mind where you think it should be going to work and where you think you should feel a difference. I'm afraid to say you can't control that. You can target a little bit more with the gel, certain areas by application, but when you're taking it orally, those molecules will enter the blood and they'll go to work where they need to. So always remember, take more if you're not seeing things changing. Do persist to 3 to 4 months, where 90% of people will see a difference, because once you see that difference, you won't stop and the healing journey continues. The healing journey is not over at 3 to 4 months. That's a time frame for you to see change, positive change. The redox lifestyle is the healthy lifestyle. Everything that affects health for the better is affecting redox signaling molecules, everything, whether that is breathing clean air, whether that is drinking cleaner water, whether that is eating a more nutritious diet, whether that's losing weight. everything you can think of that benefits your health, including the use of herbs, is affecting the redox space, and nutrition included. They're all affecting the redox space in different ways. The difference between ASEA and those other health promoting activities is ASEA actually is a supplement of redox signaling molecules. Nutrition is not. Herbs are not. Exercise is not. I mean, I must say exercise does increase more mitochondria in your skeletal muscle cells, so you will be producing a little bit more of redox signaling molecules there. But the only way that's ever been discovered that I'm aware of at this point in history where you can replenish the redox signaling molecules to the optimum level is to take ASEA Redox. That is the only way to date that we know we can do that. All those other parts of a healthy lifestyle will enhance the redox space, affect the redox space, but they are not redox signaling molecules per se.
This has been a fast hour, you know, especially when there's at least two bright minds here from opposite sides of the world. Well, you guys are all too kind. You know, it's such a thrill to be, you know, with bright people and to showcase this and to talk about things that are really, when you understand the basic science, it's so logical. You know, this is how the cells were designed to work. And we're really simply talking about aligning ourselves with the processes that our cells operate on. And when you do that, things work better. Dr. Ray first, and then Dr. Ed to close out for us. Would you each take 30 seconds? You're in an elevator with somebody and you're riding up to the umpteenth floor, and they notice that you have you know, an ASEA label on your shirt or your hat or something, and they go, well, tell me, what is ASEA? What would you say in your elevator speech? You had to precisely say it.
I kind of respond by saying, well, it's the greatest health supplement that has ever been discovered, in my honest opinion. I'm a naturopath chiropractor. I've been in the health industry over 40 years. You know, I've used herbal medicine, nutritional medicine, and all forms of natural healing, including homeopathy, and I've never seen anything help the body to heal itself like this supplement. And then I just wait for what the hell is it?
Dr. Ed, close us out. What would you say on the elevator?
Okay.
To impress me, what would you say?
It's the ethical company that found the greatest breakthrough in our lifetime. And if you want to know about it, hit me or call me or things like that. And I would just hit the last word about how to get in touch with him. But it's the greatest breakthrough in our lifetime. And ASEA is the most ethical company to have it.
They really are, and it's been my treat to be with them now for this time. Well, for those of you who are listening or watching to this session, please get back with the person who invited you to watch this or who sent it to you, and follow up with them. Do your due diligence. There's a ton of research out there. You know, when people say there isn't the science behind this, it is true that we don't have random controlled trials yet. I'm on the medical board for the company, and so I'm a little bit privy to what's going on. I can't disclose that here, obviously, but I know that there's some really fascinating research that's occurring and that we're staging. And as Dr. Marine always says, who's quoting our founder, Vertus Norton, it's like, we're going to do this and let the science catch up with us, because we didn't want to wait 10 or 15 years before we put this out to the public. It's transparent to medication. It's safe. There's no side effects. There's no interactions in that regard. But call and talk to the person who invited you. Give this a trial. You know, we recommend a good 90-day trial. I don't like that word trial because it always works, as we pointed out, but everybody still has to experience this on their own. And go to redoxmatters.com. There's some good science. If you want to know science, we've got an assortment of science-related stuff there. Also, you can go to discoverredox.com and see some good presentations and some good information there that will help you drill a little bit deeper and, as I say, connect the dots. I am not aware of who we have on as next week's guest because Jim and Ann Glenn skipped town and they did not let me know that, but I'm sure that there is a fascinating guest. I hope that you will join us next Friday. That's the US time. You can convert that to whatever time zone you're in around the world. I thank Dr. Ray Dixon from Phuket, Thailand for joining us, and Dr. De Los Reyes from, I think you said Kentucky, right?
Yes.
Yes, Kentucky. Formerly from the Philippines, myself, Lee Ostler, thank you for being with us. And I hope everybody has a good ASEA weekend coming up. Thank you.